Good afternoon, and today we have a very unique guest. We can call him Ron, or he has a virtual name called Jawhacks. He has a podcast what devoted to facial aesthetic, airway health, Jawhacks, and how to make it all happen. Good afternoon, Ron.
Good afternoon, doctor. Thank you for having me. I'm happy to be here.
And if you have trouble sleeping or sleep next to the snoring partner, this program gonna be really for you, because you're gonna hear about ways how to fix all of that, not from the doctor, not from the patient from my practice, but from somebody who is bringing the truth. He is a patient advocate, and he shares his own experience with the different strategies. If you're a medical professional, I'm sure this interview going to bring you a lot of wisdom, because the opinion going to be very different. Maybe some controversy going to be in our conversation, because actually the way how my philosophy and Ron philosophy not in the same lines, not in the same swim lines. And I'm going to tell you how we met. We met on the MewCon, on that conference, what organized by Mike Mew, devoted to mewing and different aspects of facial development and treatments, what we can provide in the present time. And I listened to Ron lecture, and I look at his channel and YouTube videos, and I highly recommend you to, if you're interested in the topic, to listen to that. You're gonna get a lot of information. And he is been studying mewing for the 10 years, because he had his own concerns, which he will share in a moment. And he got through different treatments himself and studied other treatments. And maybe he found topic with asymmetry, what we talk a lot with a physical therapist on, he found that also provocative related to the jaw health and the face aesthetic and airway health. So let me start with the first question. Can you please share your story with us, how you got exactly here with your health journey?
Yes, happy to, and thank you for the introduction. So I started as a patient. I'm not a healthcare provider, health professional, doctor, dentist of any kind. I was a patient who had really, really bad headaches. That's sort of my entry into the space, was severe, chronic headaches emanating from the back of my neck and spreading up into my eyebrows, my temples, my forehead, coming along with nausea, vomiting. And for many years, it was like one big headache, starting basically my freshman year in high school, which is when my childhood round of orthodontics, which included 8 extractions, 4 wisdom teeth, 4 premolars, and then braces that pulled everything back. As soon as that all ended, my headache started, and then started getting progressively worse until about 8 years later, I'm basically disabled and looking for some kind of help, right? And what I would notice is that I would go to bed feeling great, and I would wake up feeling awful. It got to the point that I was afraid to go to sleep. So I eventually, using logic and just my experience again, realized, okay, something is happening in my sleep that's bad. And one thing led to another, some basic Googling. This was back in 2014. I realized, okay, there's this thing called sleep disordered breathing. How does that work? Oh, it's not like a genetic thing. It's not like a biochemical thing. It really has to do maybe with this thing called the airway, the size of your mouth. And it occurred to me as I started meditating on it and experimenting with, my bite, my tongue posture, that, okay, there's really something off about my mouth. My tongue doesn't quite seem to fit in my mouth. When I try to relax my tongue, it wants to poke out of my mouth. And then I became really fixated on this question, how do I make my mouth bigger? I proceeded to try various dental expanders, and had mixed results with many of them. I documented my experience with those expanders online. This started in 2017. My first treatment was in 2016. By 2017, I started blogging it. I continue to blog to this day about my experience with treatment. But basically, Facebook groups picked up my blog and started sharing them, and were like, hey, look, this guy is trying this expander, and look at what's happening. Is this legit? Is this real? What do we think about this? And then my channel grew organically just from me documenting my own experience. Got to the point where I milked my own experience for all that I could get out of it, but still wanted to remain involved in this space and bringing insight and wisdom about airway health and jaw hacking, for lack of better terms. So what was next is I just started interviewing doctors and dentists who were prominent in the field, and just querying them about topics in general and not just about my own case. And that's where my channel is now. It's a podcast where I interview orthodontists, ENTs, maxillofacial surgeons, myofunctional therapists, and patients who are interested in this space. Recently, I had a plastic surgeon on, and we talked about peripheral nerve surgery and cosmetic enhancement for the nose and the face. So, I'm interested in airway health and cosmetic enhancement through jaw surgeries and other modalities, and I bring on professionals to discuss all that on my channel, Jawhacks.
No, that's a fantastic story, and I want to start with bring you to the beginning of the story, and I want to talk about, homeoblock, how we call it, or it's in general, it's a sagittal expander. When I share my philosophy with patients, and also I want to mention, I love your classical description, because what you describe, somebody who had orthodontic treatment, 8 teeth or 4 teeth, first bicuspid removed, and then got into, I call it sleep disorder breathing mode with a headache and tiredness. It's so classical. It's my everyday life. And I recently wrote the article about that. What people look like twins to me without seeing them. They have exactly the same medical history with the acid reflux and high blood pressure, atrial fibrillation, allergies, a history of asthma, depression. And basically, I'm unrefreshed. I fall asleep and wake up in much worse condition. I'm afraid to sleep. Like everything what you said, it's so typical, so like everyday life for me. And I like to hear it from you. And of course, my heart bleeds for people like you, and I really want to help them. And I'm trying to look into my armamentarium, what I can do. And sagittal expander is one of the choices for people who don't want oral appliance therapy, because oral appliance therapy not gonna cure the condition. Somebody who cannot do myofunctional therapy for various reasons as well. So I offer several treatments. But then they read the book Breath, and they're looking for sagittal, because that's how it was described by James Nestor. So tell me, what was benefits and negative sides of the sagittal treatment you experience helping you, because it was, I understand, was a first step in your journey?
Correct. Yes, the sagittal appliance was definitely the first step in my journey. That started in the summer of 2016 with a doctor named Kent Lawson out of Aurora, Colorado. He wrote this book called Straight Talk About Crooked Teeth, where he talked about how crooked teeth is really not a matter of, a genetic thing. It's really just about the jaw bones being too small to support the teeth. And in that book, he presented various expanders. And so I thought, oh, this guy knows what he's talking about. Let me go see him. But first, actually, my first appointment on the subject of sagittal expanders was 2 years earlier, when I went to Thousand Oaks, California to meet Dr. Hang. So actually, I saw Dr. Hang, but I couldn't afford his treatment. I waited 2 years and then discovered Dr. Lawson's book, and then went to see him about his version of the same type of sagittal appliance that Dr. Hang was using. Not exactly the same, but basically the same. And so my experience was not positive with the sagittal expander. I did not get any relief to my headaches. I did gain a little bit of tongue space in my mouth, but essentially what happened with me, and I was age 26 at the time, so an adult male, which, as you know, are the most stubborn types of patients in all types of cases like this, whether it's a tooth-borne expander or a skeletal expander. Adult males are tough because our bones are so fused, like cement instead of like clay. And what I had with my sagittal expander was a lot of dental tipping. My front teeth were flared, my molars were flared, and around my upper molars, I had a lot of gum loss on the tongue side of my mouth, to the point where my general dentist, when she saw me when I was 6 months into treatment, she said, "What the hell is this? This looks awful." Now, in all fairness to sagittal appliances, I was a remote patient. So Dr. Lawson was in Colorado. I was in the Boston area. So he was not monitoring me as closely as he probably should have. So that is a factor in my case. I don't know if everyone would have this, the same negative result that I had with the sagittal expander. I do think categorically that there's problems with sagittal expanders for adults. And that problem is basically that, when you use the teeth as levers to try to expand the bone, the teeth will generally give out first, just because teeth roots are weaker as they sit in the alveolar bone than the mid-palatal suture, which, presumably is where you would want the expansion to occur with an appliance like this. Although I guess, if you look at if you look at dentoalveolar expansion as opposed to pure skeletal expansion, right, then maybe these appliances get some dentoalveolar expansion where they lead to some bone density increase at the alveolar ridge, maybe some tipping of the ridge itself, so it's not really dental as much as it is dentoalveolar. I do think there's a distinction to be drawn there. But yeah, I did not have a good experience with my sagittal expander. I got a lot of tooth damage, a lot of tooth flaring, and essentially no clinical benefit, no sleep disordered breathing improvement, no improvement to my headaches, a little bit of tongue space, but that was mostly just a result of the teeth tipping out. So I can't really say too much positive about that.
That's your opinion, and great. What was your I have two questions. Did you try mewing in the same time? I understand what you're very close to that strategy as well. Did you have a combined therapy, let's call it? You try to help yourself with the mewing as well, or it was purely sagittal expansion?
No, I had been mewing really like mindfully and deliberately for 2 years before I got my expander. And actually, I tried to use mewing to do the work of the expander. That's another reason why I didn't pursue treatment with Dr. Hang, was because I was like, hey, I just discovered this mewing thing. Mewing was just starting online back in 2014. I was like, maybe this works. Maybe I can grow my jaws with just mewing alone. And I did get some increase in tongue strength. I did get some better definition of my facial muscles with mewing. But I did not get any meaningful change in the jaw size or in the increase in tongue space. So my mewing plateaued after about a year. And that's when I really committed to doing the expander. So yes, I was having the best tongue posture I could have when I did have the expander. But of course, these expanders are so big and bulky, it's hard to they're not low profile by any means. I mean, they're big, chunky pieces of plastic, and it's hard to mew well when they're in. Yeah, you can kind of press on them, but another problem that I discovered later, I at least put the words to it later, was that my mouth was too small to really be mewing in the first place. And on my channel, I call this the mewing catch-22, where in order to have big jaws, you need to mew, but in order to mew, you need to have big jaws. So I was always able to get kind of the tip of my tongue up, but in terms of suctioning on the palate, like what Sandra Khan calls the uplock, I could not really do that. And to this day, I still can't really do that well. And I think a lot of people that have deficient jaw structure really struggle with mewing anyway, because mewing presupposes a certain amount of natural anatomy, which people that by definition are interested in mewing don't really have that in the first place. So I think
that's the wisdom. That's the wisdom of the modern world. I would put it this way, because we see, I see it every day, but still want to help my patients. My question to you, what was your next step? And I have to apologize because my dog is also very interested in our conversation and she's trying to, participate.
oh well.
So tell me, what was, when you realize what sagittal expansion is not for you, but you still pursue, you still want to go further. What's the next step you did?
So the next step was another, what I would consider to be dental expander that was also did not provide any meaningful benefit, and again had some negative consequences for the teeth. And then at that point, I was like, okay, I have to find a way that doesn't involve pushing on teeth to try to make my jaws bigger, because this just isn't working. The teeth keep giving out and the jaw doesn't move, right? It's like, pushing trees in the land and the trees just tip over rather than the land splitting or something like that. So eventually in 2019, I discovered MARPI, or at the time what was called MSE. MSE, of course, is just a brand of MARPI, MARPI being the larger, broader category of TAD-fastened skeletal expanders that screw into the roof of your mouth and then split the mid-palatal suture and expand it transversely left to right. So I discovered MSE in 2019 and was treated with MSE in 2019, and for the first time meaningfully made my palate bigger. I probably got 7 or 8 millimeters of expansion at the mid-palatal suture. I had diastemas in my teeth, and a massive improvement in my nasal breathing. Got a little bit of pharyngeal airway relief just by allowing the tongue to come up and forward into that new oral space. And so that was the next thing I did, was MSE in 2019, with kind of mixed results, because yes, I got all these benefits that I just described. Oral volume increase, nasal volume increase, pharyngeal airway relief, better ability to mew by having more tongue space. But I did not have a perfect expansion. I had a little bit of an asymmetric expansion, which is kind of one of the big problems with MARPI, as we would all soon discover. Something I've talked a lot about on my channel is the dangers of MARPI and how asymmetries can occur. And they occur for a variety of reasons. There's no one reason, but they're common, though, is the thing. And you have to be really experienced and really careful as a provider to avoid them. So it's really worth noting that asymmetry is common and dangerous with MARPI. And I had a little bit of that. So that was the next thing I did. So essentially, I had very mixed results with the various treatments I tried, and was documenting the whole thing. And again, that's how my channel grew. Was because I was honestly stating what my experience was with these expanders.
Got it. My question to you, how did you work when you did MARPI? Did you work also with the physical therapist to be able to align asymmetry of your body to kind of reduce MARPI asymmetry, or it was purely MARPI that time?
It was a purely MARPI asymmetry. And I think it probably usually is. It's so easy for the MARPI to go asymmetric, right? MARPI can be asymmetric if it's designed asymmetrically, if it's placed asymmetrically, if it reorients itself into an asymmetric position during the split. Okay, if there's no surgical assist done, it can reorient itself later in expansion once the leverage force on it is greater, if it doesn't have enough dimensional stability, and the forces of the jaw can actually twist the appliance. So there's so many ways for MARPI asymmetry to occur, and in my case, I don't know exactly what it was, but it didn't really have anything to do with my body beneath the neck. I think it just had to do with I think what happened in my case is because I was an adult male and the only surgical assist I had was cortical puncturing, which is basically taking a dental drill and drilling micro perforations along the mid-palatal suture to try to weaken the suture. In 2019, there was no piezotome osteotomy of the mid-palatal suture in the anterior nasal spine, so the cortical puncturing of the midline was the best you could get, but it's really not enough for adult males, or even really for adult females. Dr. Manueli says that he recommends, piezotome for pretty much all adult patients. But I think what happened in my case is if you look at my photos, the appliance begins in a straight orientation, but then as I'm turning it and trying to split my suture, it twists. It twists. And I think what happened was because, again, I was a remote patient without, not able to see my doctor as much as I should have. I think I just expanded too much into that twisted appliance, and then I had, instead of expanding perfectly left to right, it kind of expanded diagonally, which caused the left side of my palate to come forward and drop a little bit. Yeah, I think that's what happened.
Wow.
And that's very common, by the way. Very common.
I just recently I was on AAPMD, and we listened to the lecture from oral surgeon and from physical therapist about asymmetry. So this is a hot topic you're talking about, and that's scary. That's scary for both provider and the patient. But they explain, the way to address it, from a physical therapy perspective, from fascia and muscle support. In your case, probably the remote was not. Such a great option in this particular case, even though if it wouldn't be remote, it's really hard to imagine how it can be changed in that moment as well.
Well, that's a great point. It can't really be changed. Now in 2024, there's so many more protocols for dealing with the problem that I had, right? So now, you wouldn't use an MS. First of all, you wouldn't use an MSE in an adult like me. You would use an appliance with much better dimensional stability that wouldn't twist. You would use a Partners Dental Studio custom Marpy, or you would use an FME, which is they're both much more rigid appliances that are stronger when they face forces from the skull as you try to expand. So MSE is too weak for adult males. That would be different. I would have had a piezotome surgical assist to weaken the suture and release the suture so that the appliance wouldn't have to work so hard to split the suture, which is maybe what caused it to twist. That's second. Third, there's the conversation about asymmetry is much more out there now, so people are looking for it, and you can't see things that you're not looking for. So
True.
Now people are looking for it. And they know that if you see an appliance twisting like that, and if you see an asymmetry forming, two things. Number one, you can abort treatment and just turn it back, and no harm, no foul. You end up right where you started, which, sure, it sucks that you did you paid and you went through the heartache of having these tads put in your mouth. But if you catch it and you abort it, hey, at least, you're not left with permanent damage. And then second, if you catch a slight asymmetry forming, you just make sure not to overexpand into it. So a little bit of asymmetry is actually okay. It can be dentally corrected, but you have to just make sure you don't expand crazy into it.
To you, Ron, would be about jaw surgery. I know you talk a lot about jaw surgery. What's your opinion about the jaw surgery?
My opinion about jaw surgery is that this whole space started with trying to avoid jaw surgery. A lot of the dental expanders are marketed on the idea that it's a non-surgical way of fixing small jaws and sleep disordered breathing. And I think that, sure, jaw surgery, the way it used to be done, could be very dangerous, and it still can be dangerous. But I think that when you set avoidance of jaw surgery as your primary treatment objective, it leads to a lot of potential rabbit holes of, dental expanders in adult males that end up just tipping teeth and getting no benefit. I think that more patients would be better served by a safe jaw surgery than you would think. I think that, again, the key with jaw surgery is don't clump all jaw surgery as created equal. The key with jaw surgery, because it's such a high stakes surgery, and I'm talking about MMA surgeries, mandibular maxillary advancement surgeries, where you cut the upper jaw, you cut the lower jaw, you widen and move them both forward together, rotate them to get a little bit of upswing. And we're talking, 1 centimeter of advancement here, or more. Some patients are getting, 2 or 3 at the tip of the chin in terms of advancement. These are remarkable changes that patients can experience, and they can experience them relatively quickly. It's a 1 to 5 hour surgery, let's call it. It's a rough recovery for a couple weeks. But in the end, if the surgery goes well, and that's the key, is to choose a surgeon that can make the surgery go well, you really have a dramatic positive reconstruction of your facial structure that can put a big dent in sleep disordered breathing or aesthetic concerns that can result from having jaws that are, small and deficient. So I advocate, don't, you maybe disagree with this, but I advocate avoiding dental expanders, seeking skeletal treatment modalities such as MARPI, safely done, or orthodontic surgery, safely done, and then go see a top surgeon. Go see a Michael Gunson, go see a Ben Wallian, go see a David Alfie, go see a David Bell. And there's others, but that's sort of my short list of surgeons. And see if you're a candidate, because these people are surgeons that only do orthodontic surgery. They do many cases a week. They've done hundreds, maybe thousands of cases in their lifetime. And generally speaking, they're pretty safe. And the result you can get with a jaw surgery is really, again, I don't want to understate this, it can be really remarkable in terms of jaw advancement, transverse expansion, all in a matter of 1 day plus a couple weeks of recovery. So I'm bullish on jaw surgery as long as it's done in the care of an elite provider.
Thank you very much, Ron. I really appreciate your honest opinion and your journey, what you so openly share with us. And people who are interested in finding the solution for the problem, you have to visit and listen to the John channel, to the interviews, and go on his YouTube, Jawhacks, and visit his website, also Jawhacks. Thank you very much, Ron.
Thank you, doctor. It was a pleasure.